able to go see any doctor you want. Areas of service, that's another important aspect of Medicare Advantage plans. If you bought a regional Medicare Advantage plan, I can't name any carriers, but most of them that you see on TV are considered regional players. They only operate in certain counties, because that's where their network is. So if you're from here and you happen to be traveling in Florida and you have a PPO plan, you get sick there, but not so sick that it's considered life-threatening if not treated within 24 hours, have no coverage. Follow that? It's an important aspect. Any network requires you to stay in the network unless it's a life-threatening condition not treated within 24 hours. So areas of service are important to know about. Medications and costs, we already went through that. Your premium, how much you pay for the plan, what your deductibles and co-pays are, and most importantly, carrier stability. Carrier stability is important in Medicare Advantage. It's such a new program that carrier stability is very important because carriers have been coming in and leaving the market. What happens is they come in one year, say, we got this. We know how Medicare Advantage should work. We got a pricing structure good. They come into market, they don't realize the risk associated with it, and next year they cancel everybody saying we're getting out of the business. So you have to go through searching all that again. You want to make sure that the carrier is committed and financially solvent and stable in the industry. Ways to stay healthy. Does the carrier provide you additional benefits over the regular preventative care for Medicare? Some do, some don't. But you got to read the fine print. Okay. So, because, as I said before, all insurance is just pure mathematics, here's the math. Very simple. When we take a look at the different types of Medicare Advantage plans and supplemental plans, the pure math basically will bring you to the conclusion that based on whether or not you want to stay in a network or not, you're going to join one of these types of plans. The first mathematical equation here is if you've joined a PPO Medicare Advantage plan. This bar here represents the actual total catastrophic risk on a monthly basis. In other words, if you had the maximum amount of claims and paid the total out-of-pocket maximum for that plan. Remember the total out-of-pocket was $4,500? You remember that? So if we add the out-of-pocket, our premium, and all the co-pays and everything we pay, you joined the PPO in Suffolk County, you could end up paying $517 a month on average. You know. But if you had no claims at all, you'd pay $38 a month because you just pay your premium and that's it. If you took a supplemental plan, the Medicare Supplement Plan F, that wraps around your coverage and gives you 100% for all Part A, Part B, and drug coverage, you can end up paying $402 a month on a catastrophic claim. If you chose an HMO, which has all the restrictions of you can't go outside their network, but it has a lower out-of-pocket maximum, you could end up actually paying $432 a month. That's your out-of-pocket risk. If you chose an MSA, a medical savings account, your total out-of-pocket can be no more than $292 a month, catastrophically. So if we had $1 million claim on any one of these plans, just apply the same claim across all of them, that's the math how it works out, what your total out-of-pocket maximum would be on a monthly basis. 500, 400, 400, 292. So if we analyze the risk of Medicare and add insurance to wrap around to eliminate that risk from us, MSA is the true winner because it's at the lowest out-of-pocket cost and any doctor, any hospital, anywhere, at any time. HMOs, only their doctors, PPOs, penalties if you leave the system. Supplements, any doctor, any hospital, anywhere, at any time, higher out-of-pocket cost. Everybody with me on so far? So then, of course, you want to know, well, if I join these types of plans, how many doctors can I see? Well, I analyze that too. If you get a supplement, which is secondary insurance, plus you have the access to 789,000 physicians in the New York area. Because you can see any doctor, any hospital, anywhere at a time, right? If you chose an MSA, you have the same thing, same amount of physicians, 789,000. If you chose a standard PPO, you have a choice of about 4,172 physicians in the New York area. Significantly less because you have to stay in their network. If you chose the HMO, it's about the same. All right? So you can see, when we analyze it from the money aspect, from the service aspect, meaning access to physicians, these two are highly restrictive. These two, any doctor you want. Most latitude as far as who you want to see. So our solution has always been, and unless there's some overriding reason that you can tell me, like I want to go into a PPO because, we always recommend an MSA for most people because you can see any doctor you want, has a zero premium, you have a low out-of-pocket cost for prescription drugs. There's all kinds of other benefits that can be bundled in there at zero cost for you. So MSAs offer the best solution as far as I'm concerned. But if your doctors and your hospitals are part of a PPO, and they're saying, listen, either join that plan or I won't treat you, that's the plan for you. Because if you want to stay with that physician, you got to go where he wants to go. Okay. This is just some other stuff we're going to talk about. So we're going to go into the Q&A. Anybody have any specific general questions? You do.
I'm here for my son.
Mm-hmm.
His birthday is May 8th.
Right.
He's still working and he's retiring at the end of the year.
Right.
When should he?
SCP. He's gonna wait till the month in which he retires. The month before that, he's gonna call Medicare and say, I'm retiring in February, whatever it is.
He's retiring at the end of November.
December 31? November. Call October, say I'm retiring in November. He'll get an SCP, he'll enter into that system. You have to be very careful of the COBRA offer, because the carrier might, your employer might say, hey, we'll give you COBRA. You might want to take the COBRA for the 2 months, and then go on January 1 for that. You have to sit down and look at the COBRA option for you. Yeah.
One of the two retiring, the other one leaving, but with the
One that's not retiring, are they the primary or the secondary? Okay. When the primary retires, you're going to get a COBRA offer, most likely. You got to remember about the SEP and the general enrollment. You'll probably want to just go straight on to Part B, and the other individual who's under 65 will take the COBRA option of the primary spouse and run that for the 18 months. Yeah. So that's another thing. That's another. I'll be right with you. That's another aspect. When you retire from an employer, and that employer, let's say I'm the primary and my wife is covered underneath me, I retire off. They'll offer me COBRA with dependent coverage. Because I'm Medicare eligible, I have the right to waive off COBRA, which makes the spouse eligible for COBRA. But most COBRA administrators will tell you, you have to come on to get your spouse on. That's wrong. It's a violation of federal law. So you have to be careful of that. Yep.
Medical savings account, 2,500?
Yeah.
Is that per person or?
Per person. All Medicare is a per person. There's no such thing as family coverage in Medicare.
So,
it's your account alone.
In a certain year, I use 2,200. Do I have 300 to the good, and I
That's
get
a-
another 25?
That's an excellent question. The answer is yes. Whatever money you don't use out of your MSA account every year keeps rolling over for infinity. So if you're in good health, you have, let's say you get 5 years and you're using $500 a year health care, you could technically end up with more than $10,000 in cash in that account. This is the interesting aspect of MSAs. If you were in like a PP or an HMO, you wouldn't have any money left over. But in those plans, you don't have the advantage of an MSA. The MSA says any money in your account you can use for any qualified medical expense, not necessarily Part A or B. Example, let's say I had $10,000 in my account. Let's go back to that. That's a very good question, which I always get, and I'm neglectful for not actually illustrating that. Let's go back over here. Yeah, okay. Let's say my exposure is $1,750 this year, because it's a brand new year, and I get my $2,500 deposit, I don't spend it for whatever reason. Next year I get another one, I have $5,000. The deductible on an MSA is $4,250, but I have $5,000 in my cash account. That means I have a surplus of roughly $800. Let's say I need a tooth replaced, like a crown. I can actually spend the money out of that account to get my crown covered. It won't reduce my deductible, but because the IRS says it's qualified medical expense on your tax return, I could spend the money out of my MSA to cover that healthcare cost. That's free money. You know how that works? That's really important. That's a good point. So as you build up money, once you have more than $4,250 in cash in your MSA account, that money can be spent on things other than Part A and Part B coverage, like tooth, vision, hearing aids, all the things that Medicare doesn't cover, you can spend out of your MSA account. But I'm going to go to this gentleman here. I'm sorry.
I retired 2 years ago, kept my medical through work.
Yeah.
My wife just retired last year in June.
Right.
She's covered under my plan.
Right.
I didn't take Medicare. We have Part A, that's all I have.
Right.
But I'm trying to, now, she just will be 65 in May, next month.
Right.
She just had received her card and everything.
Right.
Something from Social Security saying we're gonna deduct X number of dollars for this Part B.
$104, yeah.
Right. We don't want that. I wanna stay with my,
Well, Social Security say, I want to waive off.
well, I got that,
Yeah.
I got that. But does it pay to keep what we have or to go, this seems like more money it's gonna cost me.
Well, it depends on how much you're paying for your group coverage through your employer. You have a retirement benefit, right?
Yeah, I pay $250 a month.
Well, you're paying, that's $3,000 a year you're paying.
Right.
Yeah, you're better off actually to flip out of that and go into an MSA, because the MSA would cost you $0 per month. So
Okay.
you'd actually, you get $3,000.
But that's-
You can have 500 of that put into a gift for me.
Okay.
$20,000.
And we'll go golf, but that's gonna cost us, for both of us, 300.
Doesn't matter. MSAs for both of you would be $0.
Okay. But how much a month?
$0.
Zero.
Zero cost, no cost. Let me rephrase it. MSAs don't cost anything. They don't, it's zero premium.
Okay.
Yeah.
His spouse was 65 on day. I'm already 65.
You're kidding.
I wanted to start that.
Yeah.
I really, I want to know if they think how plenty of really good.
Yeah, I'd have to look at the details of your plan, but most likely it's, unless you're getting it through like a union or,
It's a union.
it's a union plan.
Right.
Okay, and if you don't pay anything for a union plan because it's considered a retirement benefit, you're better off to stay in the union plan. But if you're paying for it, and you have to do them mathematically, the equation,
That's what I want.
then probably most likely you're better off to stay in a union plan.
That's what I'm saying.
Yes.
Are you
All right.
saying something about the MSA plan, they put 2,100 in your account? Can you use that, let's say you need to go to the dentist, can you use that anytime, or you say you need to?
Yep, anytime you want.
Okay.
Sure.
All right, you had been telling us something about, pre-existing conditions.
No
Is that
pre-existing, no pre-existing conditions in Medicare. Sorry?
Okay.
No pre-existing conditions in Medicare, period. When you enter the plan,
Okay,
no.
and is there an income limit to medical supplement?
No income limits in Medicare. The only time income comes into play is the premium they charge you. If you earn so much above a certain dollar limit, they charge additional premium for your Part B or your prescription drug coverage.
The MSA, I thought there was no premium.
There is zero premium on an MSA.
Okay, so that means the part that they normally take out of the Social Security, no.
It would be there. It's always going to be there. If you join a Medicare Advantage, this is a very important point. I'm glad you brought this up. When you join any type of Medicare Advantage plan or Medicare supplement, you will always pay your Part B $105 premium to Medicare.
Okay, so that's always been.
That's a constant, never going to change. Yeah.
Yes, I have a question. About the Plan B, you said automatically I should join the Plan B when I reach 65, even though I'm working.
Well, if you have group benefits through an employer and you're still working and they're paying for it, or you have a coach, you want to call Medicare and say, I'm waiving Part B, I'm still employed and not taking Social Security. You waive your Part B, don't pay the premium, and then what'll happen is, as you go down the road, let's say you turn, I don't know, 69 years old, you say, okay, I've had enough. On that time, you will enter your special enrollment, you'll call Medicare and say, enter me into Part B, they'll enter the Part B system the next month for you. As long as you're still working, you can do that. Yeah.
If you get the MSA, you still have to get Part D.
You have to get a Part D with it, yeah, right. MSAs are considered Medicare Advantage
Is
ones.
it still the same choices of the drug?
Yeah, there's, yeah, any drug plan that's available in the marketplace.
Question?
Sure.
All right, I will be 65 till, June of 2015.
Right.
If I go on COBRA, it'll end the end of with those 5-6 months till I take an MSA plan or get Medicare, will I have to worry about pre-existing conditions if I go on a bridge plan or anything like that?
No pre-existing conditions in Medicare. If you take
Well,
the COBRA,
But I'm gonna have those 6 months where I won't have COBRA and I won't have Medicare.
right, that's why you don't want to go on your COBRA. What you want to do is, when you turn 65, you want to take your Medicare Part B and waive your COBRA, because if you take your
No, wait,
COBRA...
I need COBRA now
Oh,
for a
because
year
you're
and a half.
63 and a half now.
And then I'll have 6 months where I need to get something.
Okay, so
So
you'll
I
be
have-
like 64 and a half at that point? Okay, yeah, you need to take a bridge plan to bridge you the 6 months to get to the 65th. But there's no pre-existing in Medicare. Because what's gonna happen for you is you're gonna enter into what's called a special enrollment period 3 months before your 65th birthday. So as long as you enroll in that period of time, when you turn 65, you could have been uninsured for years. It won't make any difference. No pre-existing condition will enter the system and you get covered.
When, 3 months before?
The first day of the month in which you turn 65.
Okay, but those 6 months before, like January through beginning of June.
Yeah, you're gonna
When I'm
have
not on COBRA, will the bridge plan cover any conditions I had before that?
Depends on which kind of bridge plan you get, but generally, as long as you don't lapse your health care insurance in New York State more than 63 days, there's no pre-existing conditions imposed. So let's say you
No, I'd
end...
probably go to the bridge plan right after.
Right after, so you'll have no exposure. Yeah, you're exposure. Yeah.
Yes, I'm already on a PPO plan already.
Yeah.